Question 1. Assessment of a firm, non-tender, exophytic lesion on the buccal mucosa of a patient reveals characteristics that are concerning for a neoplastic process. The dental hygienist has completed their intraoral assessment and has identified this abnormality. What is the most appropriate immediate course of action for the dental hygienist? Option A. Document the lesion thoroughly, including its size, color, texture, and location, and immediately inform the supervising dentist of the finding for further evaluation and diagnosis. Option B. Inform the patient that the lesion is likely benign and suggest they try a specific over-the-counter antifungal medication to see if it resolves. Option C. Attempt to definitively diagnose the lesion as either benign or malignant based on visual characteristics and inform the patient of the suspected diagnosis. Option D. Advise the patient that the lesion appears to be a common irritation and recommend they monitor it for changes over the next few weeks. Correct answer is A. Document the lesion thoroughly, including its size, color, texture, and location, and immediately inform the supervising dentist of the finding for further evaluation and diagnosis. Explanation. This scenario presents a professional challenge due to the inherent uncertainty in diagnosing pathologic conditions, the potential for patient anxiety, and the ethical obligation to provide accurate and timely information while respecting patient autonomy and avoiding overstepping professional boundaries. The dental hygienist must balance the need for definitive diagnosis with the limitations of their scope of practice. The correct approach represents best professional practice because it adheres to the established scope of practice for dental hygienists as defined by the Dental Hygiene National Board Examination, DHNBE, regulatory framework. This framework emphasizes the hygienist's role in assessment, identification of abnormalities, and referral to the appropriate licensed professional for definitive diagnosis and treatment planning. Specifically, it aligns with the ethical principle of beneficence by ensuring the patient receives the necessary advanced diagnostic evaluation and treatment from a dentist, while also upholding the principle of non-maleficence by avoiding the misdiagnosis or inappropriate management of a potentially serious condition. The hygienist's responsibility is to recognize and report, not to diagnose. An incorrect approach of attempting to definitively diagnose the lesion as benign or malignant is a direct violation of the DHNBE regulatory framework and the scope of practice for dental hygienists. This constitutes a failure to uphold professional competence and could lead to significant harm to the patient if the diagnosis is incorrect, delaying necessary treatment or causing undue alarm. Furthermore, it breaches the ethical principle of veracity by presenting information that is beyond the hygienist's authorized diagnostic capabilities. Another incorrect approach of withholding information about the observed lesion from the patient and the supervising dentist is a failure to uphold the ethical principle of transparency and patient autonomy. The patient has a right to be informed about findings in their oral cavity, and the dentist requires all assessment data to formulate a comprehensive treatment plan. This omission could be considered a breach of professional duty and could impede timely and appropriate care. Finally, an incorrect approach of recommending over-the-counter remedies or home treatments for the observed lesion is unprofessional and potentially harmful. This action bypasses the established diagnostic and treatment pathways, potentially masking symptoms or exacerbating the condition, and is outside the scope of practice for a dental hygienist. It fails to ensure the patient receives evidence-based care from a qualified practitioner. The professional decision-making process in such situations involves a systematic approach. 1. Recognize and document the abnormality. 2. Consult with the supervising dentist immediately. 3. Communicate findings to the patient in a clear, non-alarming manner, emphasizing the need for further evaluation by the dentist. 4. Follow the dentist's instructions for referral and patient management. This process ensures patient safety, ethical conduct, and adherence to regulatory guidelines. Question 2. Comparative studies suggest that the most reliable method for detecting early enamel demineralization and incipient caries involves a combination of diagnostic techniques. A dental hygienist is examining a patient and observes a chalky white spot on the facial surface of a maxillary premolar, which feels slightly rough to gentle tactile exploration. Radiographic examination reveals no interproximal radiolucencies in the same area. Considering the available diagnostic information, which of the following represents the most appropriate approach to assessing the caries status of this tooth? Option A. Integrate the visual and tactile findings with the radiographic evidence to determine the presence and extent of demineralization. Option B. Conclude that no active caries is present because the radiograph shows no interproximal lesions. Option C. Rely solely on the tactile examination, as the roughness indicates a cavitated lesion requiring restoration. Option D. Focus exclusively on the visual appearance of the white spot, assuming it represents arrested demineralization. The correct answer is A. Integrate the visual and tactile findings with the radiographic evidence to determine the presence and extent of demineralization. Explanation. This scenario presents a professional challenge because the dental hygienist must integrate multiple diagnostic modalities to accurately assess caries, a process that requires careful judgment to avoid both underdiagnosis and overdiagnosis. Underdiagnosis can lead to disease progression and potential tooth loss, while overdiagnosis can result in unnecessary restorative treatment, increasing patient cost and potentially compromising tooth structure. The DHNBE emphasizes evidence-based practice and adherence to established clinical guidelines for caries detection. The correct approach represents best professional practice by prioritizing a comprehensive assessment that combines visual and tactile examination with radiographic interpretation. This aligns with the principles of evidence-based dentistry, which advocate for the use of multiple diagnostic tools to achieve the highest diagnostic accuracy. Regulatory frameworks for dental hygiene, such as those overseen by the American Dental Association (ADA) and the Commission on Dental Accreditation (CODA, mandate that dental hygienists perform thorough patient assessments, which inherently includes the integration of all available diagnostic information. Ethical guidelines also require dental hygienists to act in the best interest of the patient, which necessitates accurate diagnosis to guide appropriate treatment planning. An incorrect approach that relies solely on visual inspection is professionally unacceptable because early or subsurface caries may not be apparent visually. This failure to utilize other diagnostic tools can lead to misdiagnoses, violating the ethical duty to provide competent care and potentially contravening regulatory requirements for thorough assessment. Another incorrect approach that solely relies on radiographic evidence is also professionally unacceptable. Radiographs are two-dimensional representations and may not accurately depict the true extent of demineralization, especially in interproximal areas or when there is significant plaque accumulation obscuring the tooth surface. Furthermore, radiographic interpretation alone can miss smooth surface lesions or early enamel demineralization. Relying exclusively on tactile examination can be misleading, as a soft, sticky surface may be due to plaque rather than active demineralization, and tactile exploration can sometimes inadvertently create cavitation in demineralized enamel, leading to a false positive. The professional decision-making process for similar situations should involve a systematic approach. First, conduct a thorough visual examination, noting any signs of demineralization, discoloration, or cavitation. Second, perform a gentle tactile examination, using a blunt explorer to assess surface texture, but avoiding forceful probing that could damage enamel. Third, interpret radiographic images in conjunction with clinical findings, looking for radiolucencies that indicate demineralization. Finally, integrate all findings to form a definitive diagnosis, considering factors such as patient risk assessment, salivary flow, and dietary habits to determine the appropriate management plan. This integrated approach ensures a comprehensive and accurate assessment, upholding professional standards and patient welfare. Question 3. The efficiency study reveals that a dental hygiene practice is experiencing delays in patient flow, particularly with patients who have a history of cardiovascular disease. Which of the following approaches best addresses this challenge while maintaining patient safety and adhering to professional standards? Option A. Focus solely on expediting the appointment schedule for these patients, minimizing chair time and deferring any in-depth medical history review to a later, less busy appointment. Option B. Routinely postpone all elective dental hygiene appointments for patients with any documented history of cardiovascular disease until further medical clearance is obtained, regardless of the nature of the planned treatment. Option C. Proceed with standard dental hygiene procedures for all patients, assuming their cardiovascular condition is stable and does not require special considerations during routine care. Option D. Implement a standardized protocol for all patients with a history of cardiovascular disease, including pre-appointment anxiety reduction techniques and modified anesthetic choices, and ensure clear communication with the patient regarding their treatment plan. Correct answer is D. Implement a standardized protocol for all patients with a history of cardiovascular disease, including pre-appointment anxiety reduction techniques and modified anesthetic choices, and ensure clear communication with the patient regarding their treatment plan. Explanation. The efficiency study reveals that a dental hygiene practice is experiencing delays in patient flow, particularly with patients who have a history of cardiovascular disease. This scenario is professionally challenging because it requires the dental hygienist to balance efficient patient management with the critical need for safe and individualized patient care, especially for those with systemic conditions. The potential for exacerbating a cardiovascular condition due to stress or specific dental procedures necessitates careful judgment. The correct approach represents best professional practice because it prioritizes patient safety and adherence to established clinical guidelines for managing patients with cardiovascular disease. This involves a thorough pre-procedural assessment, including reviewing the patient's medical history, current medications, and any physician's recommendations. It also entails modifying treatment protocols as needed, such as using local anesthetics with vasoconstrictors cautiously, managing patient anxiety, and potentially scheduling appointments during times when the patient is typically more rested. This aligns with the ethical obligation to provide competent care and the regulatory framework that mandates patient safety and informed consent, ensuring that all necessary precautions are taken to prevent adverse events. An incorrect approach that involves proceeding with standard protocols without considering the patient's cardiovascular history is professionally unacceptable. This failure constitutes a breach of the standard of care and violates ethical principles of beneficence and non-maleficence. It disregards the potential for serious complications, such as arrhythmias, myocardial infarction, or hypertensive crisis, which could arise from inadequate management of a patient with cardiovascular disease. Such an approach also fails to meet the regulatory requirements for patient assessment and individualized treatment planning, potentially leading to disciplinary action. Another incorrect approach, such as unnecessarily postponing all dental hygiene care for patients with any history of cardiovascular disease, is also professionally unacceptable. While caution is warranted, blanket restrictions without a proper assessment can lead to delayed necessary care, impacting oral health and potentially overall well-being. This approach fails to demonstrate professional judgment and may not be supported by current evidence-based practice guidelines, which often allow for safe dental treatment with appropriate modifications. It also fails to uphold the principle of providing necessary care when it can be delivered safely. The professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly review the patient's medical history and current health status, paying close attention to any systemic conditions. 2. Consult with the patient about their condition, any physician's recommendations, and their current symptoms. 3. Assess the specific dental hygiene procedures planned and identify any potential risks associated with the patient's systemic condition. 4. Modify treatment plans as necessary, incorporating appropriate precautions, such as medication adjustments, anesthetic choices, or stress management techniques. 5. Document all assessments, decisions, and modifications clearly in the patient's record. 6. Communicate effectively with the patient and, if necessary, with their physician to ensure coordinated and safe care. Question 4. To address the challenge of developing a comprehensive dental hygiene care plan for a new patient presenting with multiple oral health concerns and a history of limited access to care, which of the following approaches best reflects current professional standards and regulatory expectations for dental hygienists? Option A. Apply a standardized, one-size-fits-all treatment protocol to all patients with similar presenting symptoms, without significant individualization. Option B. Immediately proceed with the most requested treatment by the patient, assuming their self-diagnosis is accurate and their preferences should guide all interventions. Option C. Focus primarily on addressing the most visible or symptomatic oral health issues, deferring less apparent concerns to future appointments to expedite the initial visit. Option D. Conduct a thorough medical and dental history review. Perform a comprehensive oral examination including periodontal assessment and caries risk evaluation. Discuss findings and patient goals, and collaboratively develop a personalized, evidence-based treatment plan with clear objectives and patient education components. The correct answer is D. Conduct a thorough medical and dental history review, perform a comprehensive oral examination including periodontal assessment and caries risk evaluation, discuss findings and patient goals, and collaboratively develop a personalized, evidence-based treatment plan with clear objectives and patient education components. Explanation. This scenario presents a professional challenge because developing a comprehensive dental hygiene care plan requires a thorough assessment of the patient's individual needs, risks, and preferences, while also adhering to established professional standards and ethical obligations. The dental hygienist must balance the patient's stated desires with evidence-based practice and the legal scope of practice. Careful judgment is required to ensure the plan is safe, effective, and patient-centered. The correct approach represents best professional practice because it prioritizes a holistic assessment that includes the patient's medical history, oral health status, and psychosocial factors. This aligns with the ethical principles of beneficence and autonomy, ensuring the patient's well-being and right to participate in their care decisions. Furthermore, it adheres to the regulatory framework of the Dental Hygiene National Board Examination, DHNBE, by emphasizing a systematic and evidence-based approach to care planning, which is fundamental to competent dental hygiene practice. This approach ensures that the plan is tailored to the individual, addresses all relevant risk factors, and is documented appropriately, fulfilling professional and legal responsibilities. An incorrect approach that focuses solely on the patient's immediate requests without a comprehensive assessment fails to uphold the dental hygienist's duty of care. This could lead to overlooking underlying oral health issues or recommending interventions that are not in the patient's best long-term interest, potentially violating the principle of non-maleficence. Such an approach also neglects the regulatory requirement for a thorough patient evaluation as the foundation for any treatment plan. Another incorrect approach that relies exclusively on generalized treatment protocols, without considering the patient's unique circumstances, disregards the principle of patient-centered care and autonomy. While protocols provide a framework, they must be adapted to individual needs. Failing to do so can result in inappropriate or ineffective care, and may not meet the standards for individualized care planning mandated by professional guidelines and regulatory bodies. A third incorrect approach that prioritizes expediency over thoroughness, such as rushing through the assessment or documentation, compromises the quality of care and introduces risks of errors or omissions. This directly contravenes the professional obligation to provide diligent and accurate care, and can lead to regulatory scrutiny for inadequate record-keeping or substandard practice. The professional reasoning process for similar situations should involve a systematic approach. First, conduct a comprehensive patient assessment, medical, dental, social history, oral examination, radiographic interpretation, periodontal charting, etc. Second, identify the patient's chief complaint and their stated goals for treatment. Third, analyze the assessment findings to identify oral health problems, risk factors, and potential barriers to care. Fourth, develop a prioritized list of treatment objectives. Fifth, formulate a treatment plan that is evidence-based, individualized, and addresses the identified objectives, incorporating patient preferences and values. Sixth, communicate the treatment plan clearly to the patient, obtaining informed consent. Finally, document the entire process thoroughly. Question 5. Strategic planning requires a dental hygienist to conduct a thorough hard tissue examination. When evaluating a patient's teeth and occlusion, which of the following approaches best aligns with the comprehensive diagnostic standards expected in dental hygiene practice? Option A. Systematically examining all tooth surfaces for caries, calculus, and defects, and meticulously assessing the patient's occlusal relationships, including interferences and wear patterns. Option B. Focusing primarily on identifying obvious signs of decay and ignoring any subtle occlusal wear or potential interferences. Option C. Assuming that a patient's occlusion is healthy if they are young and do not complain of jaw pain. Option D. Relying on the patient's self-reported symptoms to guide the extent of the hard tissue and occlusal examination. The correct answer is A. Systematically examining all tooth surfaces for caries, calculus, and defects, and meticulously assessing the patient's occlusal relationships, including interferences and wear patterns. Explanation. This scenario presents a professional challenge because a dental hygienist must accurately assess and document hard tissue conditions, including occlusal relationships, to ensure appropriate treatment planning and patient care. The DHNBE emphasizes the importance of a thorough and systematic examination to identify deviations from normal anatomy and function. The challenge lies in differentiating between normal variations and pathological conditions, and in understanding the implications of occlusal discrepancies for oral health. The correct approach represents best professional practice because it involves a systematic, comprehensive evaluation of all hard tissues, including detailed assessment of occlusion. This aligns with the standards of care expected of dental hygienists, as outlined by regulatory bodies and professional associations that govern dental hygiene practice in the United States. A thorough examination ensures that all relevant findings are recorded, facilitating effective communication with the dentist and contributing to an accurate diagnosis and treatment plan. This systematic approach minimizes the risk of overlooking critical issues, thereby protecting patient well-being and adhering to the ethical obligation of providing competent care. An incorrect approach that focuses solely on visible decay without assessing occlusal wear or interarch relationships fails to meet the comprehensive examination requirements. This oversight could lead to misdiagnosis, inadequate treatment planning, and potential long-term issues for the patient, such as temporomandibular joint dysfunction or further tooth wear. Ethically, this approach violates the duty to provide thorough and competent care. Another incorrect approach that prioritizes only the patient's chief complaint without a complete hard tissue and occlusal assessment is also professionally unacceptable. Patient-reported symptoms are important. They do not negate the need for a full diagnostic workup. Failing to conduct a comprehensive examination can result in misdiagnoses of underlying conditions that may be contributing to the patient's complaint or developing independently. This constitutes a failure to adhere to the established standard of care and an ethical breach of professional responsibility. A third incorrect approach that relies on assumptions about occlusal health based on a patient's age or perceived lack of symptoms is equally problematic. Oral health conditions, including occlusal issues, can be asymptomatic in their early stages. Professional judgment requires objective assessment, not subjective assumptions. This approach risks overlooking developing problems and failing to provide preventative or early intervention strategies, which is a deviation from best practices and ethical obligations. The professional decision-making process for similar situations should involve a systematic checklist approach to hard tissue examination, ensuring all aspects of tooth structure and occlusion are evaluated. This includes visual inspection, tactile exploration, and potentially the use of diagnostic aids. The hygienist must then correlate findings with patient history and symptoms, and communicate any significant observations to the supervising dentist for further diagnosis and treatment planning. This process ensures a holistic and evidence-based approach to patient care, adhering to regulatory requirements and ethical standards. Question 6. The monitoring system demonstrates a patient's pulse rate is 72 beats per minute. The dental hygienist palpates the radial pulse and notes that the beats are not evenly spaced. Which of the following actions best reflects a comprehensive and safe approach to this finding? Option A. Focus on the blood pressure reading, as it is a more critical indicator of immediate patient stability. Option B. Palpate the pulse for a full minute to accurately characterize the irregularity and consider the patient's medical history for any known cardiac conditions. Option C. Document the pulse rate as 72 BPM and proceed with the scheduled dental hygiene treatment. Option D. Inform the patient that their pulse is slightly irregular, but that it is likely not a concern for today's appointment. The correct answer is C. Document the pulse rate as 72 BPM and proceed with the scheduled dental hygiene treatment. Explanation. Scenario analysis. This scenario presents a professional challenge because the dental hygienist must interpret subtle variations in a patient's pulse rate and rhythm, which could indicate underlying systemic health issues. The challenge lies in distinguishing between normal physiological variations and potentially significant deviations that require further investigation or intervention, all within the scope of dental hygiene practice as defined by the DHNBE. Accurate assessment is crucial for patient safety and to ensure appropriate referral when necessary. Correct approach analysis. The correct approach involves not only identifying the pulse rate, but also meticulously assessing its rhythm. This aligns with the DHNBE emphasis on comprehensive patient assessment, recognizing an irregular rhythm, even if the rate appears within a normal range, is a critical step in identifying potential cardiac anomalies or other systemic conditions that could impact dental treatment. This thoroughness ensures the dental hygienist is acting within their professional scope, prioritizing patient well-being, and adhering to the ethical obligation to provide care that is safe and effective. Incorrect approach is analysis. Failing to assess rhythm and only noting the rate is a regulatory failure because it represents an incomplete patient assessment, falling short of the comprehensive evaluation expected of a dental hygienist. This oversight could lead to misdiagnoses of significant health conditions. Assuming a regular rhythm based solely on a normal rate is an ethical failure. It demonstrates a lack of diligence and a disregard for the potential for underlying pathology that a simple rate count would not reveal. This can compromise patient safety. Focusing solely on the pulse as a measure of overall patient stability without considering other vital signs or the patient's subjective report is a professional failing. While pulse is important, it is one component of a broader assessment, and neglecting other indicators can lead to an incomplete and potentially misleading picture of the patient's health status. Professional reasoning. Dental hygienists must employ a systematic approach to vital signs assessment. This involves not just obtaining numerical values, but also observing qualitative characteristics. When assessing pulse, the process should include palpating for rate, rhythm, and strength. Any deviation from expected findings should trigger further inquiry, including questioning the patient about symptoms, reviewing their medical history, and considering the need for consultation or referral to a physician. This decision-making process is guided by the principles of patient-centered care and the regulatory framework that defines the scope and standards of dental hygiene practice. Question 7. Compliance review shows a patient presents with generalized gingival inflammation, bleeding on probing in multiple sites, and probing depths ranging from 4–6 mm. The patient also reports occasional sensitivity to cold. Gingival recession is noted on several anterior teeth, and slight mobility is present in a mandibular incisor. Based on these findings, which of the following represents the most appropriate initial assessment and management strategy? Option A. Prescribe an antimicrobial mouthwash to address the generalized inflammation and advise the patient to brush more vigorously to improve gingival tone. Option B. Refer the patient immediately to a periodontist without performing a detailed periodontal assessment, assuming the mobility indicates advanced disease. Option C. Perform a comprehensive periodontal charting including probing depths, bleeding on probing, recession, and mobility assessment, followed by scaling and root planing, and detailed oral hygiene instruction tailored to the patient's specific needs. Option D. Focus solely on scaling the visible calculus and provide basic oral hygiene instructions, as the probing depths are not excessively deep. The correct answer is C. Perform a comprehensive periodontal charting including probing depths, bleeding on probing, recession, and mobility assessment, followed by scaling and root planing, and detailed oral hygiene instruction tailored to the patient's specific needs. Explanation. This scenario presents a common clinical challenge where a dental hygienist must interpret multiple periodontal assessment findings to formulate an appropriate treatment plan. The challenge lies in synthesizing subjective, patient-reported symptoms, and objective probing depths, bleeding, recession, mobility data to accurately diagnose the patient's periodontal status and determine the most effective and ethical course of action, adhering to the standards of care expected in dental hygiene practice as outlined by the Dental Hygiene National Board Examination (DHNBE) framework. The correct approach involves a comprehensive evaluation of all periodontal parameters, accurately recording probing depths, noting bleeding on probing BOP as an indicator of inflammation, assessing gingival recession to understand attachment loss, and evaluating tooth mobility are crucial. This systematic approach ensures that the diagnosis reflects the true extent of periodontal disease, guiding the selection of appropriate interventions, such as scaling and root planing, patient education on oral hygiene, and potentially referral for further evaluation. This aligns with the DHNBE emphasis on evidence-based practice and patient-centered care, ensuring that treatment decisions are justified by clinical findings and aimed at achieving optimal oral health outcomes. An incorrect approach would be to focus solely on one or two parameters while neglecting others. For instance, solely relying on probing depths without considering BOP might lead to an underestimation of active inflammation. Similarly, Ignoring recession or mobility would provide an incomplete picture of the periodontal condition and potential prognosis. Such selective assessment could result in an inadequate treatment plan, failing to address the full scope of the patient's disease, which constitutes a failure to meet the standard of care and could be considered professional negligence under regulatory guidelines. Another incorrect approach would be to make assumptions about the patient's oral hygiene based on limited data, rather than objectively assessing all clinical indicators. This bypasses the critical step of thorough data collection and analysis, which is fundamental to ethical and competent dental hygiene practice. Professionals should employ a decision-making framework that prioritizes thorough data collection and interpretation. This involves 1. Systematically gathering all relevant clinical data, probing depths, BOP, recession, mobility, medical history, patient concerns. 2. Analyzing the interrelationship of these findings to form a comprehensive diagnosis. 3. Developing a treatment plan that is evidence-based, patient-centered, and addresses all identified issues. 4. Documenting all findings and the rationale for the treatment plan. This structured approach ensures that decisions are informed, ethical, and aligned with regulatory expectations for dental hygiene practice. Question 8. Consider a scenario where a 55-year-old patient presents for a routine dental hygiene appointment. During the medical history review, the patient reports being diagnosed with type 2 diabetes 5 years ago and states their blood glucose levels have been consistently elevated despite medication. During the oral examination, the dental hygienist observes generalized moderate gingivitis, probing depths ranging from 4-6 mm with some bleeding on probing, and evidence of mild bone loss on radiographs. The patient denies smoking and reports a consistent, albeit basic, home care routine. What is the most appropriate initial step for the dental hygienist to take in managing this patient's periodontal risk? Option A. Acknowledge the patient's diabetes as a significant risk factor and modify the treatment plan to include more frequent recall intervals and enhanced oral hygiene education tailored to diabetic patients. Option B. Focus solely on improving the patient's current oral hygiene technique, assuming the elevated probing depths are primarily due to poor brushing and flossing. Option C. Implement a standard periodontal maintenance protocol with routine oral hygiene instructions. Option D. Immediately refer the patient to a periodontist for advanced surgical intervention. The correct answer is C. Implement a standard periodontal maintenance protocol with routine oral hygiene instructions. Explanation. This scenario presents a common clinical challenge where a patient's systemic health significantly impacts their oral health, specifically their risk for periodontal disease. The dental hygienist must integrate knowledge of systemic conditions and their oral manifestations to provide appropriate care. Correct approach involves a comprehensive assessment that acknowledges the interplay between the patient's diabetes and their periodontal status. This aligns with the ethical and professional standards of dental hygiene practice, which mandate patient-centered care and the consideration of all factors influencing oral health. Recognizing diabetes as a significant risk factor for periodontal disease and consequently tailoring the treatment plan to address this is paramount. This includes more frequent recall intervals, enhanced oral hygiene instruction, and potentially more aggressive periodontal therapy if indicated, all within the scope of dental hygiene practice as defined by the DHNBE framework. An incorrect approach would be to solely focus on the visible signs of periodontal disease without considering the underlying systemic condition. This fails to address the root cause of increased susceptibility and may lead to suboptimal treatment outcomes. Ethically, this could be considered a failure to provide comprehensive care. Another incorrect approach would be to dismiss the patient's diabetes as irrelevant to their oral health, which demonstrates a lack of understanding of the established link between systemic diseases and periodontal disease, a fundamental concept tested by the DHNBE. This would also represent a failure to adhere to professional standards of care. The professional decision-making process in such a situation should begin with a thorough medical history review, followed by a comprehensive oral examination. The dental hygienist must then synthesize this information, identifying any systemic conditions that may be contributing to the oral disease. Based on this integrated assessment, a personalized treatment plan should be developed, which may involve collaboration with the patient's physician. The DHNBE emphasizes the importance of critical thinking and the application of scientific knowledge to clinical practice, requiring the hygienist to move beyond superficial observations to a deeper understanding of the patient's overall health status and its implications for oral health. Question 9. The investigation demonstrates that a patient presents for a routine dental hygiene appointment reporting a history of hypertension and is currently taking a beta blocker. The dental hygienist has a brief conversation with the patient and notes the information in the chart. Which of the following actions best reflects the dental hygienist's professional responsibility in this situation according to the DHNBE regulatory framework? Option A. Immediately refer the patient to a physician for further evaluation before any dental hygiene treatment can be initiated. Option B. Ask the patient if they have any current symptoms related to their hypertension and then proceed with treatment without further consultation. Option C. Proceed with the scheduled dental hygiene treatment, assuming the hypertension is well controlled given the patient is on medication. Option D. Thoroughly review the patient's medical history, inquire about the duration and control of their hypertension, the specific beta blocker prescribed, and consult with the supervising dentist regarding any potential implications for treatment before proceeding. The correct answer is C. Proceed with the scheduled dental hygiene treatment, assuming the hypertension is well controlled given the patient is on medication. Explanation. This scenario is professionally challenging because it requires the dental hygienist to synthesize information from multiple sources, identify potential risks, and make an informed decision about patient care within the scope of their practice and regulatory guidelines. The dental hygienist must balance the patient's stated desire for treatment with the potential impact of their medical history on that treatment. Careful judgment is required to ensure patient safety and provide appropriate care. The correct approach represents best professional practice because it prioritizes patient safety and informed consent by thoroughly reviewing the medical history, identifying potential contraindications or necessary modifications, and communicating these findings to the dentist. This aligns with the ethical principles of beneficence and non-maleficence, ensuring that the patient receives care that is both beneficial and does not cause harm. Furthermore, it adheres to the regulatory framework of the DHNBE, which mandates that dental hygienists assess patient health status and collaborate with the dentist to provide safe and effective care. This approach ensures that all relevant information is considered before proceeding with treatment, minimizing risks and optimizing outcomes. An incorrect approach that proceeds with treatment without a thorough review of the medical history is a significant regulatory and ethical failure. It violates the principle of non-maleficence by potentially exposing the patient to harm due to unaddressed medical conditions or medications. Ethically, it breaches the duty of care owed to the patient. From a regulatory standpoint, it fails to meet the standard of care expected of a licensed dental hygienist, potentially leading to disciplinary action. Another incorrect approach, which involves making assumptions about the patient's medical conditions without verification or consultation, is also professionally unacceptable. This demonstrates a lack of due diligence and can lead to misdiagnosis or inappropriate treatment. It bypasses the essential step of gathering accurate information, which is fundamental to safe practice. A third incorrect approach, which is to defer all decision-making regarding the medical history to the dentist without any independent assessment or identification of potential issues, is also flawed. While collaboration with the dentist is crucial, the dental hygienist has a responsibility to perform an initial assessment and flag any concerns. This passive approach fails to utilize the hygienist's knowledge and skills to proactively identify potential risks, potentially delaying necessary interventions or consultations. The professional decision-making process for similar situations should involve a systematic approach. 1. Initiate a comprehensive medical history review, actively listening to the patient and asking clarifying questions. 2. Analyze the collected information for any conditions, medications, or allergies that could impact dental hygiene treatment or require modifications. 3. Consult relevant professional resources or guidelines if unsure about the implications of any medical findings. 4. Communicate any identified concerns or potential risks clearly and concisely to the supervising dentist. 5. Collaborate with the dentist to develop a safe and appropriate treatment plan, incorporating any necessary precautions or modifications. 6. Document all findings, communications, and treatment decisions thoroughly in the patient's record. Question 10. Upon reviewing a new patient's chart and preparing for their initial comprehensive oral examination, The dental hygienist considers the most effective and compliant method for conducting both intraoral and extraoral assessments to ensure thoroughness and patient safety. Which of the following strategies best aligns with regulatory expectations and professional standards for this examination? Option A. Performing a thorough visual inspection of all intraoral and extraoral tissues, but omitting palpation to avoid patient discomfort. Option B. Relying solely on the patient's self-reported history of oral health issues and performing a limited examination of symptomatic areas. Option C. Systematically palpating and visually inspecting all intraoral structures, including the tongue, floor of the mouth, palate, and oropharynx, as well as performing extraoral palpation of the head and neck lymph nodes and visual inspection of the lips, cheeks, and facial skin. Option D. Conducting a rapid visual scan of the oral cavity, focusing primarily on the teeth and gingiva, with a brief glance at the tongue and cheeks. The correct answer is C. Systematically palpating and visually inspecting all intraoral structures, including the tongue, floor of the mouth, palate, and oropharynx, as well as performing extraoral palpation of the head and neck lymph nodes and visual inspection of the lips, cheeks, and facial skin. Explanation. This scenario presents a common implementation challenge in dental hygiene practice, balancing thoroughness with patient comfort and time constraints during an intraoral and extraoral examination. The professional challenge lies in recognizing subtle abnormalities that might be indicative of serious conditions, while also ensuring the patient feels at ease and the examination is efficient. The dental hygienist must possess keen observational skills, a systematic approach, and the ability to communicate effectively with the patient. The correct approach represents best professional practice because it prioritizes patient safety and comprehensive care, aligning with the fundamental ethical and regulatory obligations of a dental hygienist. This involves a systematic, head-to-toe examination that includes palpation and visual inspection of all relevant structures, both inside and outside the mouth. This thoroughness ensures that potential signs of oral cancer, infection, or other pathologies are not missed, which is a core responsibility mandated by professional standards and state dental practice acts. Early detection is paramount for favorable treatment outcomes. An incorrect approach that involves a cursory visual inspection without palpation fails to meet the standard of care. This omission could lead to the missed detection of palpable lesions or masses that are not readily visible, thereby violating the duty to provide a complete examination and potentially compromising patient health. Another incorrect approach, focusing solely on the teeth and gums while neglecting surrounding oral structures and extraoral tissues, is also a significant failure. This narrow focus ignores potential signs of disease that may manifest beyond the immediate dentition, such as lymph node enlargement or lesions on the lips or cheeks, which are critical components of an intraoral and extraoral examination. Finally, rushing through the examination to save time, without ensuring all areas have been adequately assessed, demonstrates a disregard for patient well-being and professional responsibility, potentially leading to diagnostic errors and a breach of ethical conduct. The professional decision-making process in such situations should involve a systematic checklist approach to the examination, ensuring all components are addressed. This includes dedicating sufficient time for each step, utilizing appropriate lighting and magnification, and maintaining a high index of suspicion for any deviations from normal. When an abnormality is detected, the professional must follow established protocols for documentation, patient referral, and communication with the supervising dentist, adhering to all regulatory requirements for reporting and management. Question 11. Operational review demonstrates that a patient presents with a chief complaint of intermittent jaw pain and occasional swelling in the neck region. The dental hygienist is preparing to conduct a comprehensive head and neck examination. Which of the following actions best reflects the standard of care for assessing the lymph nodes and temporomandibular joint, TMJ, in this scenario? Adhering to the regulatory framework for the Dental Hygiene National Board Examination, DHNBE. Option A. Focus solely on palpating the TMJ for tenderness and ignore the lymph nodes, as the primary complaint is jaw pain. Option B. Ask the patient to describe the location and duration of their jaw pain and neck swelling, and proceed with the dental cleaning without further physical examination of these areas. Option C. Perform a cursory palpation of the general neck area, and ask the patient if they feel any clicking in their jaw, without detailed assessment of lymph node characteristics or TMJ structures. Option D. Systematically palpate all major cervical lymph node chains and assess TMJ function, including range of motion, joint sounds, and palpation for tenderness, documenting all findings. Correct answer is D. Systematically palpate all major cervical lymph node chains and assess TMJ function, including range of motion, joint sounds, and palpation for tenderness, documenting all findings. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the dental hygienist to integrate findings from a physical examination, lymph nodes, TMJ, with the patient's reported symptoms and medical history. The challenge lies in accurately interpreting palpation findings, understanding the potential implications of enlarged or tender lymph nodes, and recognizing signs of temporomandibular joint dysfunction, all while maintaining patient comfort and adhering to professional standards of care. The dental hygienist must exercise critical judgment to differentiate between normal findings and those requiring further investigation or referral. Correct approach analysis. The correct approach involves a systematic and thorough palpation of the cervical lymph nodes and assessment of the temporomandibular joint (TMJ) structures. This aligns with the scope of practice for dental hygienists as defined by the Dental Hygiene National Board Examination (DHNBE) regulatory framework, which emphasizes comprehensive patient assessment. Palpating lymph nodes for size, consistency, tenderness, and mobility helps identify potential infections, inflammatory processes, or even neoplastic conditions. Assessing the TMJ includes evaluating range of motion, listening for clicks or crepitus, and palpating for tenderness in the joint and surrounding muscles. This comprehensive approach ensures that potential systemic or local issues affecting the head and neck region are identified, allowing for appropriate management or referral, thereby upholding the ethical obligation to provide patient-centered care and promote overall health. Incorrect approaches analysis. One incorrect approach would be to solely rely on the patient's subjective report of pain without performing a physical examination of the lymph nodes and TMJ. This fails to meet the standard of care by neglecting objective assessment, which is crucial for diagnosis and treatment planning. Ethically, it breaches the duty to provide a thorough examination and could lead to misdiagnoses, potentially harming the patient. Another incorrect approach would be to palpate the lymph nodes and TMJ superficially without systematically assessing for specific characteristics like tenderness, mobility, or the presence of crepitus. This lack of detail renders the examination incomplete and less informative, potentially leading to misinterpretation of findings. It falls short of the comprehensive assessment expected under DHNBE guidelines. A third incorrect approach would be to perform the examination in a rushed or perfunctory manner, without adequate attention to patient comfort or the nuances of palpation. This not only compromises the accuracy of the findings, but also erodes patient trust and violates the ethical principle of beneficence, which mandates acting in the patient's best interest and avoiding harm. Professional reasoning. Professionals should approach head and neck examinations with a structured methodology. This begins with a thorough medical history review, followed by a systematic physical examination. For lymph nodes, this involves palpating all relevant cervical chains, preauricular, postauricular, occipital, tonsillar, submandibular, submental, and superficial/deep cervical, in a bilateral manner, noting any abnormalities. For the TMJ, the assessment includes observing jaw opening and protrusion, palpating the preauricular area for joint tenderness, assessing for clicking or popping sounds, and evaluating muscle tenderness in the masseter and temporalis. Any deviations from normal findings should be documented and considered in the context of the patient's overall oral and systemic health, guiding further diagnostic steps or referral to appropriate specialists. Question 12. Examination of the data shows a patient presenting with a history of intermittent sensitivity to cold in the posterior mandibular quadrant. Radiographic interpretation of a biodoing reveals a distinct radiolucency at the mesial-occlusal line angle of the second premolar, with no apparent radiographic evidence of periapical pathology on the periapical radiograph of the same area. A panoramic radiograph shows generalized bone density, but no specific pathology in the region of concern. Considering these findings, which of the following diagnostic approaches best reflects the expected standard of care for a dental hygienist in interpreting this radiographic data in conjunction with clinical presentation? Option A. Focus on the absence of periapical pathology on the periapical radiograph and dismiss the biodoing finding as a potential artifact or normal anatomical variation, advising the patient to monitor sensitivity. Option B. Prioritize the panoramic radiograph's generalized bone density assessment and conclude that no significant pathology is present, advising the patient that the sensitivity is likely due to non-dental factors. Option C. Conclude that the radiolucency on the biodoing represents early interproximal caries and recommend conservative operative intervention based solely on the radiographic finding. Option D. Integrate the biodoing finding of a radiolucency with the patient's reported sensitivity, considering the possibility of early interproximal caries or other early carious lesions, and recommend further clinical assessment and appropriate management. The correct answer is C. Conclude that the radiolucency on the biodoing represents early interproximal caries and recommend conservative operative intervention based solely on the radiographic finding. Explanation. This scenario is professionally challenging because it requires the dental hygienist to integrate radiographic findings with clinical observations to formulate a diagnosis and treatment plan. Misinterpreting radiographic evidence can lead to delayed or incorrect treatment, potentially harming the patient and violating the standard of care. The dental hygienist must possess a thorough understanding of radiographic anatomy and pathology to accurately assess periapical, biodoing, and panoramic radiographs. The correct approach represents best professional practice because it emphasizes a comprehensive assessment that combines objective radiographic data with subjective and objective clinical findings. This holistic approach aligns with the ethical and legal obligations of dental professionals to provide patient-centered care, ensuring that diagnoses and treatment plans are based on the most complete and accurate information available. This aligns with the principles of evidence-based practice, which is a cornerstone of modern dental hygiene. An incorrect approach that focuses solely on radiographic findings without considering clinical signs and symptoms would be professionally unacceptable. This failure to integrate all available data could lead to a misdiagnosis, such as identifying a radiolucency that is actually a normal anatomical landmark, or overlooking a subtle clinical sign of disease that is not clearly visible on the radiograph. Such an oversight could violate the standard of care and potentially lead to patient harm, which is a breach of professional responsibility and could have legal ramifications. Another incorrect approach that relies solely on clinical findings and dismisses or downplays radiographic evidence is equally problematic. Radiographs provide crucial information about underlying bone structure, root morphology, and the presence of pathology that may not be clinically apparent. Ignoring this vital diagnostic tool would be a failure to utilize all available diagnostic modalities, leading to an incomplete assessment and potentially a missed or delayed diagnosis. This would also fall short of the expected standard of care. Professionals should approach such situations by first meticulously examining the radiographs for any abnormalities, comparing them to normal anatomical structures, and noting any suspicious findings. Simultaneously, they must conduct a thorough clinical examination, including patient history, visual inspection, palpation, and percussion tests. The findings from both the radiographic and clinical assessments are then synthesized to arrive at a differential diagnosis, followed by a definitive diagnosis and appropriate treatment plan. This systematic, integrated approach ensures comprehensive patient care. Question 13. Performance analysis shows a patient presenting with a sudden onset of severe gingival pain, interdental necrosis, and fetid odor. The patient also reports malaise and a low-grade fever. Based on the regulatory framework and guidelines for the Dental Hygiene National Board Examination, DHNBE, what is the most appropriate initial course of action for the dental hygienist? Option A. Provide palliative care. Administer local anesthetic for pain relief, and immediately refer the patient to a dentist for further evaluation and management. Option B. Advise the patient on meticulous oral hygiene techniques and schedule a routine prophylaxis appointment for the following month. Option C. Document the findings and instruct the patient to rinse with a mild antiseptic solution, deferring further intervention until the patient reports improvement. Option D. Initiate a thorough periodontal debridement, prescribe antibiotics, and schedule a follow-up appointment in 2 weeks. Correct answer is D. Initiate a thorough periodontal debridement, prescribe antibiotics, and schedule a follow-up appointment in 2 weeks. Explanation. This scenario presents a professional challenge due to the rapid progression and potential severity of necrotizing periodontal diseases, requiring immediate and accurate assessment and intervention. The dental hygienist must act within the scope of practice defined by the Dental Hygiene National Board Examination (DHNBE) regulatory framework, which emphasizes patient safety, evidence-based practice, and appropriate referral. The correct approach represents best professional practice because it aligns with the DHNBE emphasis on recognizing and managing emergent conditions, promptly identifying signs of necrotizing ulcerative gingivitis, NUG, or necrotizing ulcerative periodontitis, NUP, and initiating appropriate supportive care, including pain management and oral hygiene instruction, while simultaneously referring the patient for definitive medical and dental management, is crucial for preventing further tissue destruction and systemic complications. This adheres to the ethical principle of beneficence and the regulatory requirement to practice within one's competence and seek consultation or referral when necessary. An incorrect approach that involves delaying referral or attempting definitive treatment beyond the scope of dental hygiene practice would be professionally unacceptable. Such actions could violate regulatory guidelines by exceeding the scope of practice, potentially leading to inadequate treatment, exacerbation of the condition, and harm to the patient. This would also represent a failure to uphold the ethical duty of non-maleficence. Another incorrect approach, such as solely focusing on routine prophylaxis without recognizing the urgency of the necrotizing condition, would fail to meet the standard of care for emergent periodontal disease, violating professional obligations to provide timely and appropriate interventions. Professional decision-making in such situations should involve a systematic process. 1. Thorough clinical assessment to identify signs and symptoms indicative of necrotizing periodontal disease. 2. Immediate recognition of the urgency and potential severity of the condition. 3. Understanding the scope of dental hygiene practice and its limitations. 4. Prompt implementation of supportive measures within the scope of practice. 5. Immediate and appropriate referral to a dentist or physician for definitive diagnosis and management. And 6. Clear and concise communication with the patient regarding the diagnosis, treatment plan, and importance of follow-up. Question 14. Benchmark analysis indicates that a dental hygienist is providing care to a patient who reports taking several prescription medications for chronic conditions, including an anticoagulant, an antihypertensive, and an antidepressant. The patient also mentions using a popular herbal supplement for sleep. During the oral examination, the hygienist observes generalized gingival enlargement and reports frequent episodes of dry mouth. Which of the following approaches best reflects the dental hygienist's professional responsibility in managing this patient's oral health? Option A. Thoroughly review the patient's complete medication list, including the herbal supplement, and correlate potential drug-induced oral manifestations, gingival enlargement, xerostomia, with the prescribed and supplemental agents, adjusting the treatment plan and providing appropriate patient education. Option B. Inform the patient that gingival enlargement and dry mouth are common side effects of many medications and that there is little that can be done by the dental hygienist, recommending they speak to their physician. Option C. Proceed with the scheduled dental hygiene treatment, focusing on plaque removal, and advise the patient to drink more water for their dry mouth, assuming the gingival enlargement is unrelated to their medications. Option D. Prioritize the removal of calculus and biofilm, as these are the primary causes of gingival inflammation, and address the dry mouth symptoms only if they significantly impede the cleaning process. The correct answer is A. Thoroughly review the patient's complete medication list, including the herbal supplement, and correlate potential drug-induced oral manifestations, gingival enlargement, xerostomia, with the prescribed and supplemental agents, adjusting the treatment plan and providing appropriate patient education. Explanation. Scenario analysis. This scenario presents a common clinical challenge where a patient's systemic medication regimen directly impacts their oral health and the dental hygienist's treatment plan. The complexity arises from the potential for drug interactions, the need to recognize and manage medication-induced oral side effects, and the ethical and legal obligation to provide safe and effective care within the scope of practice. The dental hygienist must integrate pharmacological knowledge with clinical assessment to avoid adverse outcomes and ensure patient well-being. Correct approach analysis. The correct approach involves a comprehensive assessment of the patient's current medications, including their indications, dosages, and potential oral side effects. This includes actively inquiring about over-the-counter medications and herbal supplements, as these can also interact with prescribed drugs or cause oral manifestations. The dental hygienist must then correlate these findings with the patient's oral condition, identifying any signs or symptoms that could be attributed to their medication. This proactive and integrated approach aligns with the principles of patient-centered care, evidence-based practice, and the dental hygienist's responsibility to maintain current knowledge of pharmacology as mandated by Dental Hygiene Practice Acts and National Board Examination Standards. It ensures that treatment is tailored to the individual patient's needs and minimizes risks. Incorrect approaches analysis. One incorrect approach would be to proceed with routine dental hygiene treatment without thoroughly reviewing the patient's medication list and considering potential interactions or side effects. This failure to assess critical patient information is a direct violation of the standard of care and could lead to adverse drug events or exacerbate existing oral conditions. Ethically, it demonstrates a lack of due diligence and patient advocacy. Legally, it could be considered negligence. Another incorrect approach would be to solely rely on the patient's self-report of their medications without independent verification or further inquiry, especially if the patient appears hesitant or unsure. While patient reporting is a starting point, a thorough dental hygienist must seek clarification and, if necessary, consult with the patient's physician or pharmacist to ensure accuracy and completeness. Overlooking potential interactions or side effects due to incomplete information is a significant professional failing. A third incorrect approach would be to dismiss oral manifestations as unrelated to medication without a systematic investigation. Many systemic medications have well-documented oral side effects, such as xerostomia, gingival hyperplasia, or dysgeusia. Failing to consider these as potential causes of the patient's oral complaints is a failure to apply pharmacological knowledge and clinical reasoning, potentially leading to misdiagnosis and inappropriate treatment. Professional reasoning. The professional decision-making process in this scenario should follow a systematic approach. 1. Patient history and medication review. Obtain a complete and accurate medication history, including prescription, over-the-counter, and herbal supplements. Inquire about the indication for each medication. 2. Pharmacological knowledge application. Access and apply knowledge regarding common drug interactions and oral side effects associated with the patient's medications. 3. Clinical assessment. Conduct a thorough oral examination, noting any signs or symptoms that may be medication-related. 4. Correlation and diagnosis. Correlate the medication information with the clinical findings to identify potential drug-induced oral conditions. 5. Treatment planning. Modify the dental hygiene treatment plan as necessary to accommodate the patient's medication regimen and manage any identified oral side effects. This may involve specific preventive measures, adjunctive therapies, or referral. 6. Patient education. Educate the patient about potential medication-related oral health issues and strategies for management. 7. Communication. If significant concerns arise regarding drug interactions or severe side effects, communicate with the patient's physician or pharmacist. Question 15. Analysis of a patient's oral hygiene reveals generalized plaque accumulation. Upon examination, the free gingiva appears slightly erythematous and edematous, with bleeding noted upon gentle probing along the entire gingival margin. However, the interdental papilla between the mandibular incisors is firm, pink, and fills the interproximal spaces completely, with no bleeding observed during probing. The attached gingiva appears stippled and firm. Based on these findings, which of the following best describes the gingival condition? Option A. Gingival recession affecting the attached gingiva. Option B. Localized gingivitis of the free gingiva only. Option C. Generalized gingivitis affecting all gingival components equally. Option D. Generalized gingivitis with localized healthy interdental papillae. The correct answer is D. Generalized gingivitis with localized healthy interdental papillae. Explanation. This scenario presents a common clinical challenge where a dental hygienist must accurately assess and differentiate the health of various gingival components to formulate an effective treatment plan. The professional challenge lies in distinguishing between normal physiological variations and early signs of disease, which requires a thorough understanding of gingival anatomy and pathology as defined by the Dental Hygiene National Board Examination, DHNBE standards. Precise diagnosis is critical for appropriate intervention, patient education, and long-term oral health outcomes, directly impacting the hygienist's adherence to the scope of practice and ethical responsibilities. The correct approach involves a systematic evaluation of the attached gingiva, free gingiva, and interdental papilla, correlating clinical findings with established diagnostic criteria for gingival health and disease. This aligns with the DHNBE emphasis on evidence-based practice and the application of scientific knowledge to patient care. Best professional practice dictates a comprehensive assessment that considers color, contour, consistency, and bleeding on probing for each distinct gingival unit. This detailed examination ensures that treatment is tailored to the specific condition of each area, maximizing therapeutic efficacy and preventing unnecessary or inappropriate interventions. Regulatory and ethical guidelines for dental hygienists mandate accurate diagnosis and treatment planning based on objective findings. An incorrect approach might involve generalizing the condition of one gingival area to another without specific examination. For instance, assuming the entire gingiva is healthy based solely on the appearance of the free gingiva would be a failure to adhere to the detailed assessment requirements. This overlooks potential localized inflammation or recession in the interdental papilla or attached gingiva, which could indicate underlying periodontal issues. Ethically, this constitutes a breach of the duty of care, as it leads to an incomplete or inaccurate assessment. Another incorrect approach could be to focus solely on the presence of plaque or calculus without adequately evaluating the gingival response. While plaque and calculus are etiologic factors, the gingival tissue's reaction is the primary indicator of disease activity. Failing to thoroughly assess the gingival tissues themselves, their color, contour, consistency, and bleeding response represents a deficiency in diagnostic skill and a potential violation of professional standards that require a comprehensive periodontal assessment. The professional decision-making process for similar situations should involve a structured approach. First, review the patient's history and chief complaint. Second, perform a thorough visual inspection of all gingival areas, noting color, contour, and consistency. Third, conduct a gentle probing to assess for bleeding, pocket depths, and recession. Fourth, correlate these findings with established diagnostic criteria for gingival health and disease as taught in DHNBE preparation materials. And finally, formulate a diagnosis and treatment plan based on this comprehensive, evidence-based assessment. Question 16. Quality control measures reveal that patient, initially diagnosed with moderate gingivitis and treated with a comprehensive scaling and root planing, is presenting with persistent inflammation and bleeding upon probing at their 3-month reevaluation. The patient reports consistent, diligent home care. Which of the following represents the most appropriate next step for the dental hygienist? Option A. Reevaluate the patient's oral hygiene practices. Perform a more thorough periodontal assessment to identify any localized areas of concern or contributing factors, and adjust the treatment plan accordingly, which may include localized antimicrobial therapy or referral for further periodontal evaluation. Option B. Advise the patient to simply brush more vigorously to address the persistent bleeding. Option C. Continue with the same maintenance interval and reinforce oral hygiene instructions, assuming the patient's home care is adequate and the inflammation is a normal response. Option D. Immediately reschedule the patient for another full scaling and root planing, as the initial treatment was clearly ineffective. The correct answer is A. Reevaluate the patient's oral hygiene practices. Perform a more thorough periodontal assessment to identify any localized areas of concern or contributing factors, and adjust the treatment plan accordingly, which may include localized antimicrobial therapy or referral for further periodontal evaluation. Explanation. This scenario is professionally challenging because it requires the dental hygienist to critically assess patient progress and adapt treatment plans based on objective findings, rather than relying solely on the initial diagnosis or patient self-reporting. The core of reevaluation and treatment adjustment lies in the continuous assessment of patient response to care and the ethical obligation to modify interventions to optimize oral health outcomes. The correct approach represents best professional practice because it aligns with the fundamental principles of patient-centered care and evidence-based practice, as mandated by the Dental Hygiene National Board Examination, DHNBE, regulatory framework. This framework emphasizes the dental hygienist's responsibility to monitor treatment efficacy, identify any deviations from expected outcomes, and make informed decisions about necessary adjustments. This proactive and adaptive approach ensures that the patient receives the most appropriate and effective care throughout their treatment journey, upholding the standard of care and promoting optimal oral health. An incorrect approach, such as continuing with the original treatment plan despite evidence of inadequate response, represents a failure to adhere to the principles of ongoing assessment and adaptation. This can lead to suboptimal outcomes, prolonged treatment, and potential patient dissatisfaction, violating the ethical duty to provide competent and effective care. Another incorrect approach, such as making significant treatment modifications without thorough reevaluation or consultation, could be considered outside the scope of practice or a deviation from established protocols, potentially compromising patient safety and the integrity of the treatment plan. These failures stem from a lack of critical thinking and a disregard for the dynamic nature of patient health and response to treatment. Professional decision-making in reevaluation and treatment adjustments should follow a systematic process. 1. Conduct a thorough reassessment of the patient's oral health status, including clinical signs and symptoms, patient feedback, and any relevant diagnostic data. 2. Analyze the findings in relation to the initial treatment goals and expected outcomes. 3. Determine if the current treatment plan is achieving the desired results. 4. If not, identify potential reasons for the lack of progress. 5. Develop and implement appropriate modifications to the treatment plan, which may include altering techniques, introducing new interventions, or referring to other healthcare professionals. 6. Document all findings, decisions, and adjustments meticulously. Question 17. The evaluation methodology shows a dental hygienist reviewing a periapical radiograph of a patient presenting with generalized gingival inflammation. The radiograph reveals a uniformly widened periodontal ligament space around several teeth, with no apparent loss of lamina dura or significant changes in the alveolar bone crest. Based on this radiographic interpretation, what is the most appropriate next step in the patient's assessment? Option A. Assume the widened periodontal ligament space is a normal anatomical variation and proceed with routine prophylaxis without further periodontal assessment. Option B. Correlate the radiographic findings with clinical measurements of probing depths, bleeding on probing, and gingival recession to determine the extent and nature of periodontal disease. Option C. Conclude that the widened periodontal ligament space indicates early-stage occlusal trauma and recommend immediate occlusal adjustment. Option D. Focus solely on the absence of bone loss and lamina dura changes, concluding that no periodontal treatment is necessary and proceeding with a standard cleaning. Correct answer is B. Correlate the radiographic findings with clinical measurements of probing depths, bleeding on probing, and gingival recession to determine the extent and nature of periodontal disease. Explanation. The evaluation methodology shows that a dental hygienist is assessing a patient with a history of periodontal disease. The challenge lies in accurately interpreting radiographic findings related to the periodontal ligament, PDL, to inform treatment planning and prognosis. Misinterpreting these findings can lead to inappropriate treatment, potentially exacerbating the condition or failing to address it effectively, which has direct implications for patient care standards and professional accountability as defined by the Dental Hygiene National Board Examination, DHNBE framework. The correct approach involves a thorough understanding of normal PDL anatomy and how pathological changes manifest radiographically. This includes recognizing subtle widening of the PDL space, loss of lamina dura, and changes in the alveolar bone crest, all of which are indicators of periodontal disease progression. Best professional practice dictates that the hygienist must correlate radiographic evidence with clinical findings, probing depths, bleeding on probing, recession, to form a comprehensive diagnosis. This aligns with the DHNBE emphasis on evidence-based practice and the application of scientific knowledge to patient assessment, ensuring that treatment decisions are grounded in accurate diagnostic interpretation. An incorrect approach would be to solely rely on radiographic evidence without clinical correlation. For instance, assuming significant bone loss based on a widened PDL space, without considering other factors like patient positioning during the radiograph or the presence of artifacts, would be a failure to apply a holistic diagnostic process. This could lead to overtreatment or undertreatment, Another incorrect approach would be to ignore radiographic findings altogether, focusing only on clinical signs. This would be a failure to utilize all available diagnostic tools, contravening the principle of comprehensive patient evaluation. Furthermore, misinterpreting the PDL as a static structure, rather than a dynamic tissue that responds to occlusal forces and inflammation, would lead to flawed diagnostic conclusions. Such failures represent a deviation from the expected standard of care and the ethical obligation to provide competent and thorough dental hygiene services. The professional decision-making process for similar situations should involve a systematic approach. First, gather all available data, radiographic, clinical, patient history. Second, analyze each piece of data critically, considering potential confounding factors. Third, synthesize the data to form a differential diagnosis. And finally, develop a treatment plan that directly addresses the diagnosed conditions with ongoing reevaluation. This iterative process ensures that diagnostic interpretations are robust and that patient care is optimized. Question 18. Research into periodontal risk assessment for a new patient reveals a history of poorly controlled diabetes, a current smoking habit, and probing depths ranging from 4-6 mm with moderate bleeding on probing. Which of the following approaches best reflects a comprehensive periodontal risk assessment? Option A. Evaluating the combination of systemic health factors, behavioral habits, and clinical signs to establish an overall periodontal risk profile. Option B. Prioritizing the patient's smoking status as the most significant modifiable risk factor for periodontal disease progression. Option C. Emphasizing the presence of calculus as the primary indicator of periodontal disease severity and future risk. Option D. Focusing primarily on the probing depths and bleeding on probing to determine the extent of current disease. The correct answer is D. Focusing primarily on the probing depths and bleeding on probing to determine the extent of current disease. Explanation. This scenario is professionally challenging because accurately assessing periodontal risk is foundational to providing evidence-based, individualized patient care. A failure to correctly identify risk factors can lead to inappropriate treatment planning, potentially resulting in disease progression, increased patient morbidity, and suboptimal outcomes. The dental hygienist must synthesize information from various sources to make an informed decision, demonstrating critical thinking and adherence to professional standards. The correct approach represents best professional practice because it involves a comprehensive, systematic evaluation of multiple contributing factors to periodontal disease. This aligns with the principles of patient-centered care and the ethical obligation to provide treatment that is both necessary and effective. By considering a broad spectrum of risk indicators, the dental hygienist can develop a more precise and personalized risk profile, leading to targeted preventive and therapeutic interventions. This approach is supported by the general principles of dental hygiene practice, which emphasize thorough assessment and individualized care plans. An incorrect approach that relies solely on a single, easily quantifiable factor, such as probing depths, fails to acknowledge the multifactorial nature of periodontal disease. This is a regulatory and ethical failure because it neglects other significant risk indicators that may be present, leading to an incomplete and potentially misleading assessment. Overlooking factors like smoking status, genetic predisposition, or systemic health conditions can result in underestimating a patient's true risk and consequently, providing inadequate preventive or therapeutic measures. This violates the professional duty to provide comprehensive care and can be considered negligence. Another incorrect approach that focuses only on the presence of calculus overlooks the fact that calculus is a contributing factor, but not the sole determinant of periodontal disease progression. This approach is ethically flawed as it prioritizes a visible sign over a holistic assessment of the patient's overall periodontal health and susceptibility. It fails to account for host response, immune status, and other modifiable and non-modifiable risk factors, thereby providing an incomplete picture of the patient's periodontal risk. The professional decision-making process for similar situations should involve a systematic review of all available patient data, including medical history, social history, e.g., smoking, stress, oral hygiene practices, clinical findings, probing depths, bleeding on probing, recession, mobility, and any radiographic evidence. The dental hygienist should then integrate this information using established risk assessment models or clinical judgment to determine the patient's overall periodontal risk level. This allows for the development of a tailored treatment and maintenance plan that addresses the specific factors contributing to the patient's risk. Question 19. Compliance review shows a dental hygienist is educating a patient about the presence of plaque biofilm on their teeth. The hygienist needs to explain what plaque biofilm is and why it is important to remove it daily. Which of the following explanations best aligns with the educational objectives and professional standards for patient instruction regarding plaque biofilm formation and composition? Option A. Stating that plaque is a natural part of having teeth and doesn't require special attention beyond occasional rinsing. Option B. Providing a detailed explanation of the specific microbial species present in plaque and their metabolic pathways without relating it to daily hygiene practices. Option C. Describing plaque as a visible white or yellowish coating that makes teeth look unclean and can be easily wiped away with a tissue. Option D. Explaining that plaque is a sticky film made up of bacteria and their byproducts that constantly forms on teeth, and that daily removal through brushing and flossing is crucial to prevent tooth decay and gum disease. The correct answer is D. Explaining that plaque is a sticky film made up of bacteria and their byproducts that constantly forms on teeth, and that daily removal through brushing and flossing is crucial to prevent tooth decay and gum disease. Explanation. This scenario presents a common challenge in dental hygiene practice, ensuring patient understanding of oral health principles to promote effective self-care. The professional challenge lies in translating complex biological processes like plaque biofilm formation into actionable advice for a patient. Careful judgment is required to tailor information to the patient's comprehension level and to reinforce the importance of daily hygiene practices. The correct approach represents best professional practice because it directly addresses the patient's current oral condition, plaque biofilm, by explaining its formation and composition in a way that highlights the need for mechanical removal. This aligns with the fundamental principles of preventive dental hygiene, which are mandated by regulatory frameworks like the Dental Hygiene National Board Examination, DHNBE standards. These standards emphasize patient education as a cornerstone of care, aiming to empower patients to maintain their oral health. By focusing on the sticky film and its bacterial components, the hygienist provides a clear, albeit simplified, explanation that underscores why brushing and flossing are essential. This approach is ethically sound as it promotes patient autonomy and informed decision-making regarding their oral hygiene. An incorrect approach that focuses solely on the aesthetic appearance of plaque without explaining its composition and implications fails to educate the patient on the underlying cause of potential oral disease. This is a regulatory failure because it neglects the educational mandate of dental hygiene practice, which aims to prevent disease, not just manage its visible signs. Another incorrect approach that dismisses the patient's question as irrelevant or overly technical demonstrates a lack of professional engagement and a failure to meet the patient's educational needs. This is an ethical failure, as it disrespects the patient's desire to understand their health and can lead to a breakdown in the patient-provider relationship. A third incorrect approach that provides overly complex scientific jargon without simplification would also be a failure, as it would not effectively communicate the necessary information for the patient to implement effective self-care, thus failing to meet the educational objectives of dental hygiene practice. The professional decision-making process for similar situations should involve active listening to the patient's concerns, assessing their current level of understanding, and then tailoring the explanation to be clear, concise, and relevant to their oral health. The goal is always to empower the patient with knowledge that enables them to participate actively in maintaining their oral health, thereby preventing disease and promoting overall well-being. In accordance with the ethical and regulatory standards of dental hygiene. Question 20. The audit findings indicate that a dental hygienist's documentation for patients' posterior interproximal lesion assessment is incomplete. The hygienist noted a possible carious lesion visually, but did not correlate this with radiographic findings or tactile exploration. Which of the following approaches best reflects current best practices for caries detection and assessment in this scenario? Option A. Integrate visual, tactile, and radiographic findings to determine the extent and activity of the lesion before recommending a treatment plan. Option B. Rely primarily on radiographic evidence to diagnose the lesion, as it provides a more objective assessment. Option C. Recommend a restorative intervention based solely on the visual suspicion of a carious lesion. Option D. Document the visual finding and defer further assessment until the next scheduled appointment. The correct answer is C. Recommend a restorative intervention based solely on the visual suspicion of a carious lesion. Explanation: this scenario is professionally challenging because it requires the dental hygienist to integrate multiple diagnostic modalities for accurate caries detection and assessment, moving beyond a single method. The challenge lies in interpreting the combined findings to formulate an appropriate treatment plan, balancing conservative management with the need for intervention. The correct approach represents best professional practice because it adheres to the comprehensive diagnostic standards expected in dental hygiene. It emphasizes a multifaceted evaluation, which is crucial for accurate diagnosis and patient care. This aligns with the ethical obligation to provide evidence-based care and to avoid unnecessary treatment, as well as the regulatory requirement to perform thorough assessments. Radiographic evidence, when combined with visual and tactile examination, provides a more complete picture of carious lesions, including those not yet visible clinically. An incorrect approach that relies solely on visual inspection fails to detect early or interproximal lesions that may be evident radiographically. This is a failure to meet the standard of care and could lead to delayed treatment and progression of disease, potentially violating the ethical duty to act in the patient's best interest. Relying only on radiographic findings without clinical correlation can lead to overdiagnosis or misinterpretation, as radiographic interpretation alone can be influenced by factors like restoration overhangs or superimposed structures. This deviates from best practice by not integrating all available diagnostic information. An approach that immediately recommends invasive treatment based on a single diagnostic finding, without considering the full clinical picture and potential for remineralization, is also professionally unsound. This could be considered overtreatment and may not align with current evidence-based guidelines for caries management, potentially leading to unnecessary patient expense and iatrogenic damage. The professional decision-making process for similar situations should involve a systematic approach. 1. Gather all available diagnostic data, visual, tactile, radiographic. 2. Critically analyze each piece of data, considering its limitations and strengths. 3. Synthesize the findings to form a comprehensive diagnosis. 4. Consider the patient's overall oral health status, risk factors, and preferences. 5. Develop a treatment plan that is evidence-based, conservative where appropriate, and addresses the diagnosed condition effectively.